Welcome to today's program, Teaching Students to Manage Their Life-Threatening Allergies and Asthma. My name is Sally Schoessler, and I'm Director of Education at the network, and I'm pleased to have you here with us today. Allergy and Asthma Network works hard to be sure that the patient voice is heard in every discussion. Allergy and Asthma Network is a grassroots organization that's been making a difference in the allergy and asthma space for over 35 years. Our mission is to end the needless death and suffering due to allergies, asthma, and related conditions through outreach, education, advocacy, and research. As I said, my name is Sally Schoessler, and before coming to the network, I had over 20 years of experience in school nursing. I worked as a school nurse both in private and public settings. I worked at elementary, middle, and high school settings, and I also was able to work as a school nurse teacher, which may have been one of my favorite jobs, because there I got to teach health in the classroom as well as manage the school health office, and that was so much fun to get out and be with the students all the time. I worked as the state school nurse consultant in New York and director of nursing education at the National Association of School Nurses. I'm a certified asthma educator, and I oversee programs, resources, and initiatives for the network. Today's program is going to include three main areas. We're going to have an overview of allergies and asthma. We're going to look at self-management for students, and then we're going to look at evidence-based resources for teaching and care. There are so many situations that have come up in my school nursing career and the careers of those people I know. And I'd like to have you meet Riley and Jake. Of course, the names have been changed to protect the innocent, as any good school nurse would do when telling a story. But Riley and Jake were two little guys who just had this talent for getting themselves into just a wee bit of trouble every day. And they were like too cute for words, but they just had this impishness about them. Riley had an allergy to peanuts, and he was exposed one day at lunch, and he started to show symptoms on the playground. Now, this was one of my worst fears in school nursing, that kids would have a reaction on the playground, because supervision's a little bit different there, but they've just eaten. And Riley and Jake were always together, and Riley started to have symptoms, but Riley knew what to do. He had been taught. And the other good piece is that Jake had been taught as well about what to do in the event that Riley had a food allergic reaction. So the interesting thing was that because these boys knew what to do, a tragic outcome did not occur. And we really need to remember this as we're teaching our students. When we're teaching kids to manage both asthma and allergies, it can have a life-changing effect for them, and we need to make sure that we're there for them. Well, we're going to start with an overview of allergies and asthma. So as we're looking at life-threatening allergies, it's important just to look at some data. 1 in 12 children have food allergies. The annual cost of food allergies in the United States is really now over $24.8 billion. That's a lot of resources. And children that have food allergies that also have asthma comes in at 29%. This is important because children that have food allergies and asthma are more likely to have a more severe food allergic reaction if they have one. Another thing I always found very interesting when working in the schools is that 25% of first allergic reactions happen at school. No previous diagnosis, nothing in a history that would help you to know that this child is likely to have an allergic reaction. We're looking too at 150 to 200 fatalities per year from food allergies. I'd like that to read 0. And then we talk a lot about food allergies, and a lot of what we're going to talk about today will be skewed towards food allergies. But I don't want us to forget that there are fatalities due to insect stings every year, drug allergies, and 1 to 6% of people in America have a latex allergy. And this is certainly something we still see in the schools. There are kids with latex allergies. So make sure you're thinking about that as we talk today. Well, what this comes down to is that 1 to 2 students in every classroom, in every school in our country, are at risk for a life-threatening reaction to a food allergy, to a food allergen. So that's a lot of kids that we need to be concerned for. And it really has become a pervasive health issue in our school setting. Well, that life-threatening allergic reaction is called anaphylaxis. And I'm sure most of you know all the symptoms. I just want to go over them to make sure everybody's kind of on an even playing field. So as we're looking at symptoms by system, in the mouth, you can see itching and swelling of lips and or the tongue. In the throat, they can complain about an itching sensation. They'll complain of tightness, hoarseness, difficulty swallowing. A lot of times kids will complain that their mouth and throat feel hot. With the heart, you want to look at and see if you see a weak pulse or dizziness. We see children passing out or having even a cardiac arrest from anaphylaxis. In the chest, there's a shortness of breath, cough, a wheeze, a chest pain, and tightness. And you look at some of these symptoms and you think, there's so many things it could be. But you do want to think about the big picture. And along with that health history, if you know a child does have a food allergy or another life-threatening allergy. On the skin, you might see itchings and hives and redness and swelling. You don't have to see hives for an allergic reaction to be anaphylaxis. Often that's what starts, but you don't have to have those present. And the stomach, you might have vomiting, diarrhea, and cramps. And the other thing often that a child will express to you is that they have a feeling of impending doom. Something really bad is going to happen very soon. Listen to that if a child ever tells you that. They might complain of a headache. They might have itchy, watery eyes and nasal congestion. And while you're doing an assessment for anaphylaxis, if you're a school nurse, keep in mind that, you're not going to decide every child with itchy, watery eyes has anaphylaxis. I mean, that could easily be a ragweed allergy that is just, they need some antihistamine and they're fine. It's when you see these reactions, either very severe or in one or more body systems, that you really want to think about anaphylaxis. So the goals of allergy care at school are really twofold. We want to think about prevention and we want to be ready to give emergency care. So when we're talking about prevention, we're thinking about planning. We want to make sure that we have policies and procedures in place. You want to have a good system for notification, making sure that people can get a hold of the school nurse, and also a good medication policy and procedure. And that includes if you've got a fire drill, are you taking your medications out with you? We used to have a suitcase that was one of those rolling suitcases. And when we would have an evacuation, I would pop the inhalers and the epinephrine auto-injectors, as well as my order book, pop them in the suitcase and out we go. Obviously, you don't want to have too rigorous of a procedure for getting medications outside, because we don't want the nurse to burn up in the event that the evacuation is a real fire. Something quick, something reasonable. And then we want to think too about care planning. I love to write care plans. I'm just one of those unusual people. But a couple of things when you're thinking about writing care plans. Children with food allergies, they likely need an emergency care plan more than anything. Although writing an individualized healthcare plan for a child with a very complex situation is incredibly appropriate. But when you're doing care planning, you want to make sure that you write a care plan that is succinct, it's feasible to do, and especially if it's for an emergency care plan, it's got to be in easily understood language. Care plans are another thing I like to talk about, and that could be a whole nother hour, so we'll leave it there for today, but if you have a question about that, don't hesitate to ask. And you want to think as you're planning about food label reading, making sure that the people that are supervising the student can read the food label and understand what they see. A lot of people may not understand that if you see whey, W-H-E-Y, on a food label, a food content list, that would be an issue for a student with a dairy allergy. So it might not say milk, but you need to be able to be sure that you're reading those food labels well. And then student education. We really need to make sure that we're taking, and that's one thing we're going to talk at length about today, is making sure we're educating our students so that they can take care of themselves and make sure they can advocate for themselves. When it comes to emergency care, we need good protocols in place. We need to be sure that children have emergency care plans, and those are written for staff so that they really can just follow simple rules about what to do if a child is thought to be in anaphylaxis. We also want to make sure of easy availability of epinephrine. Students should be bringing it to school if it's diagnosed for them, but prescribed for them, but also stock epinephrine. This is available in almost every state. And so, but it's not always implemented. So if your state allows for stock epinephrine, but you're not implementing it, I would encourage you to look for ways to make that happen. Because if a child is going down, stock epinephrine allows you to help them without doing anything that's outside of appropriate nursing care. A staff response is also important to go over. We have a document called Allergy and Anaphylaxis, a practical guide for parents and families. And I'll show you that, schools and families. We'll show you that later in the presentation. But we do have something in there called tabletop drills. And this allows staff to practice what you would do. It's like in a fire drill. You're not going to set a fire in order to have a drill. And same thing with an allergic response. You can have a drill where you sit around the table and you talk through what would you do in the event that this was happening. So when we're looking at allergy care in the school, we've had successes and we still have challenges. Successes include that awareness has been raised. Certainly, people now know about epinephrine, they know about food allergies. When I first started school nursing back in the early 1990s, there was not much out there and people were not very aware. So that has been an incredible advance. There are resources available. Epinephrine auto-injectors are accepted as a great tool in caring for students with allergies. And I just want you to be aware that very likely within the next year, we're going to see a nasal delivery system for epinephrine. So that might be a game changer. So watch for that. And then we also have seen stock epinephrine being approved in every state but one. And stuff, but like I said, it's not always implemented. So take a good look at what's available to you and do what you can to make sure that you have that available for your students. When it comes to challenges, I think one of the biggest challenges a school nurse has is time. Time to educate people, time to do everything you need to do. We also need to consider administrative buy-in. A lot of times you talk to your principal about things that need to happen, or even your nursing supervisor, and they just may have other priorities. And you just want to make sure that you work hard to have them understand why caring for students with allergies can be so important. Another thing is always funding and resources. Again, I've been there. I've been at the desk trying to figure out how are we going to get what we need with the budget we have. And the other thing I just think is a constant challenge in schools is the number of school nursing positions. I think every student should have access to a school nurse every day. And it's not that there's a shortage of school nurses, it's that there's a shortage of funded positions. So again, get parent support if you need to, but if you need to get more school nurse positions in your district, do what you can so that we can keep children safe. And we change our focus over to asthma. It's important to look at some of the basic data for asthma. 29 million Americans have been diagnosed. In fact, this number is now closer or just over 26 million. And of those people, 1 in 10 are children. So again, this is a big issue in the schools. There's $80 billion worth of annual costs for asthma. And this is, I think, the square that it just hurts my heart, is that there are over 3,000 deaths annually due to asthma. I mean, we're not just talking, this is an inconvenience. I heard a story of a dad who they figured they had the money to either buy the diapers for the baby or his asthma inhaler. They chose the diapers, and he died in the driveway because he didn't have his medication. So, I mean, this is still a big issue, and we need to make sure that we're taking care of our kids. And also, we need to be advocating for health equity, because the death rate is 75% higher for Black persons than white persons. And again, this should never be. We're looking at asthma as the #1 reason that students miss school. They miss 13.8 million school days per year. And if you ever need a great statistics to talk about why it's important to be educating on asthma, it's right there. There are 14.2 million missed work days per year, not just because of parents that are home with their children, but of adults that struggle with asthma as well. Another sad statistic is that 3 in 5 people limit their physical activity. When you have asthma that's in control, you don't need to limit your physical activity. So it's important to empower kids to feel that they can do anything as long as they're getting the correct care and they're following their medication protocols or treatment plans. Another interesting data point is that 71% of people misuse inhalers. So, and when we're educating students, it's super important to make sure we're educating their parents as well. So one thing we find really helpful here with this is using the videos that are online to help students understand how to use their inhalers and encourage them to watch it with their parents. Because if the student comes home and says, you know, the school nurse told me to do it this way, and the mom says, oh, that's not how we do it, we're not going to see a change in health behavior. So you want to think about how can you incorporate both parent and child into some of these teachable moments. 1 in 5 people cannot afford their medications. If you go on our website, we have some medication assistance links where you can look to see the exact medication that's been prescribed and how to get people some help to afford their medications. And that's another really big issue for a lot of people. So asthma, we're looking at different facets. We look at the fact that there's difficulty in breathing with asthma. We get inflamed airways. We look at mucus in the air sacs, and that blocks the airways. And then that constriction where the muscles tighten and people just really have a hard time breathing. I mean, we've all seen students whose faces look like this, and then you know that child is in distress. We like to talk about quiet asthma and noisy asthma. The noisy part of asthma is that bronchospasm that's happening. These are when your airways are sensitive and they tighten and constrict. Airflow is blocked, and in order to try to help to free that up, you see coughing and you hear wheezing. But there's always also a quiet part of asthma, which is due to inflammation. And the quiet part of asthma is something that you often cannot feel happening, but it restricts airflow in the lungs. Shortness of breath occurs, and this is serious because it creeps up on people. So you've got that quiet part, but then you've got the noisy part. And sometimes, just so that you know, you may have a child that never wheezes with asthma. They just cough and cough and cough. So you want to make sure you're looking at the whole picture when you're assessing a student's asthma. When we're looking at the goals of asthma care, we really want to make sure that this child is in control, and we want to really promote good routine care. We want to make sure that the doctor's orders are something that is accessible to them and understandable. We want to make sure that we're training staff to react to any issues. But both at home and at school, we need to be very aware of what medications the students are taking. And so if you're a school nurse, you want to know what they're taking at home. This is where we're going to look later at the respiratory treatments posters that Allergy and Asthma Network has put out for years and years and years. This is how I got to know the network in the first place, because I felt like I couldn't be a school nurse without my inhaler poster. But the best part about it is that a student often can't tell you the name of their medication, but they can point to it on the poster. And sometimes that can make a huge difference in understanding whether they had their quick relief inhaler at home or their controller medication. And then again, we want to make sure we're educating students. Both students and staff you can use a straw demonstration with them. People that don't have asthma don't understand how frustrating it is to not be able to breathe well. So I encourage you to consider taking a plastic straw. And you know, the paper ones don't work quite as well. And you can have the person just blow through the straw, and you can hold their hand at the bottom, and they can feel how easy it was to get the air out and how much air came out. And then you have to pinch it a little bit, and then they find out that, oh, that really is, it's not getting as much air out, and I'm pushing, but it's not working. And then you can nearly occlude the straw, and then they're like, I get it. I get it that the lungs are constricting and I can't get air out. And sometimes you see more compassion at that moment than any other time, but it's a really good educational tool. We want to make sure that we're using an asthma action plan for children. There are a lot of templates out there, but we strongly recommend the SAMPRO action plan. It's got the green, yellow, and red zones. You can find it online by just Googling SAMPRO asthma, and it'll come up. You will have to put in like a name and an email address when you go to the website, but don't worry about that. It's really just for tracking who's using it. The resources are all free, and it's got medication permission on it as well. It's a really nice asthma action plan. And another thing to keep in mind is that families often don't really understand how to use an asthma action plan. So that's another great role for the school nurse to step into and help them to understand what it means and how to use it. With asthma, we've had successes and challenges in the school setting. And on our successes, again, we've seen a high level of awareness about asthma, and that there are a lot of resources available. And a lot of school nurses are very comfortable in caring for students with asthma. And I would challenge you to say that I think some school nurses are too comfortable for caring for students with asthma. And you know, we can certainly assess students quickly, but we can assess students well. And listening for breath sounds is important, and making sure that we're getting a history of how the child slept last night, and just really checking for asthma control when we're assessing a student. When it comes to challenges, I think one of the biggest things we need is access to stock albuterol. This is a law we have it in maybe about 15 states, but this would allow for a child to have medication available in an emergency. I think there's also a low level of understanding on how to use an inhaler and a nebulizer. But I also think, too, we need to be really aware of what are the environmental triggers in our schools and in our school district. And one of the worst things we can do is have those buses idle outside the school. That is just looks like you're just trying to, you know, set off asthma issues with that. So just be aware of what's going on. When we look at helping students self-manage their health conditions at school, one thing we have to talk about is developmental stages. And I mean, this is like the million-dollar question: what is normal? And I contend there is no normal. There's just who each of us are. And so we want to look at development both physically and emotionally, as well as socially and cognitively. And we could add moral, culturally, and spiritually in here as well. I want you to keep in mind as we go through this, and you'll see this quite a few times today, that developmental capabilities do not equal chronological age. I had a student in 6th grade who could, with minimal supervision, change her diabetes insulin pump site. And I mean, she was fabulous. I mean, I kind of always wanted to watch her, because I always felt like I learned some tricks of the trade while I was watching her do it. And whereas there are some students in high school that struggle just to check their blood glucose level. And this relates to asthma and allergies as well. We're going to see some students who are really capable of caring for themselves, and others that just don't seem to understand what that means. So we're going to look at 5 age groups today. And again, I want you to keep in mind that even though we're talking about age groups, each student is going to be developmentally in their own place, and it might not match up with a chronological age. We're going to look at preschoolers from 3 to 5 years, early elementary students from 6 to 7, upper elementary from 8 to 11, middle school from 12 to 14 years, and high schoolers at 15 to 17 years. So in the preschool years, what's happening here is that parents are providing care, and they're helping the child to learn about his or her body and routines of daily life, like you need to have medicine. So when we're talking about those self-care skills that preschoolers can do, what we really want to do is lead them to the point where they will follow an adult's instructions for treatment. The preschooler is not going to be self-managed. You want to make sure with asthma that the child knows to tell parents or responsible adults if it gets hard to breathe. And same with allergies, that you want them to learn to tell parents or responsible adults when those allergy symptoms are occurring. And adults can really help the child to develop language to express what they are feeling. You know, kids will say things like, my breath feels weird. And instead, you might want to help them say, my chest feels tight. To help them to identify it in a way that when they tell an adult, the adult will want to take action and understand that they need to. So the specific considerations for preschoolers are we need to help them to learn to cooperate. I know some people are going to go, well, that's an interesting idea. No, but the child needs to learn to cooperate when they're using their inhaled medications or their emergency allergy medications. And we need to provide age-appropriate education. Children can learn about asthma and allergies at the developmentally appropriate level. Sometimes it's fun to tell a preschooler that their lungs are like an upside down tree, where it's got the big trunk at the top and the big branches, and then you get all the little branches and the little leaves. And the little leaves can be all the alveolar sacs, but we can find a way to make this easy for them to understand. And also we want the child to learn to identify how to alert an adult when they have an issue. So topics for discussion and teaching could be like, where are your lungs? Student might not know. How do they work? How should you tell if your breathing is hard? And then for allergies, do you know what you're allergic to? Help them identify that. How can you tell someone that you feel like you might be having an allergic reaction? And then help them think about allergens as invaders. In this day and age of all the Marvel movies and everything, students would understand allergens as invaders, even at the preschool level. For early elementary years, at ages 6 to 7, we want to see that parents and adult caregivers help the child navigate separation from their parents. They're gone a lot more at this age. So we want them to learn to communicate asthma and allergy symptoms to a teacher or caregiver. And we want them with asthma to learn to trust caregivers beyond their mom and dad. And same thing with allergies, but also to know where their medications are at home and at school. When we're thinking about our elementary kids, we want to help them understand what their asthma triggers are or what their allergens are. Kids can understand a lot, but it does need to be presented in an age-appropriate way. And children can help in the administration of medications. If they've got a valve holding chamber or spacer to go with their inhaler, they can help to put that on there. And really, we can help the child to identify which are their routine medications and which might be an emergency medication. So for discussing and teaching, you might say to a student with asthma, what do you think triggers your asthma? When do you need your medication? What color is your inhaler? Help them to tell you about things. And if they can't answer these, you're going to help them find the answers. For the student with an allergy, tell me what happens if you eat a food you're allergic to, and how do you get help when you need it? As we get to the upper elementary years of 8 to 11, children are really starting to focus a lot more on their peers and that peer-peer friendship thing. So parents can clarify responsibilities outside of the home and really talk about safety rules and social etiquette. So what you want to help them think about with overall skills is they still just need to know when to get help. And they can independently request or use their emergency medication. They're much more at this age able to go to the school health office and say, I need my inhaler. When they're younger, they don't always understand when that is. So you can, with asthma, Have them recognize the symptoms of asthma and know what daily and quick relief medications they have. And that's a really big help for them to be able to start to really get a grip on that. For allergies, help them to recognize what are the symptoms of an allergic reaction and when do they know to pursue care. And they should become more involved in that care. So they should be beginning self-care in upper elementary school, but you don't go 0 to 60 in 20 seconds with things like health education. So you want the child to be able to start to identify the technique and need for inhaled medications, as well as their emergency epinephrine. We're trying to bring the children into some of the decision making at this age. The child can make more decisions regarding care, when they need their inhaler, how to avoid allergens. Give them that empowered feeling. And another thing we have to watch out for at this age is this is when we worry about the beginning of bullying. A child can identify bullying. We want them to understand what that's bullying and learn strategies to manage bullying in and out of school. Discussion points at this age might be, show me how you use your inhaler and what does your medication do in your body? And for a child with an allergy, it could be, how do you avoid your allergens at school or at home? Has anyone bullied you because of your allergy? And really give them the tools and strategies to deal with anybody that might bully them. In the middle school years, at ages 12 to 14, parents are going to provide a framework for increased independence and learning life skills and discuss strategies for more complex tasks. So here are the skills that we're going to look at are students should be able to carry their medication when that's appropriate and allow for increasingly independent care whenever possible. Really start to build that empowerment. Certainly you can, with asthma, you can develop a medication routine with parental supervision and help them to learn that if it's prescribed for them to seek medication before they exercise. Again, get them that feeling that they can do anything. With allergens, they want them to know how to avoid their allergens, help them start learning to read food labels and learn how to assess the environment for safety. Student can learn to self-medicate at this age, start that process of self-management and teach them to self-report. If they've had a bad day, make sure they're telling the school nurse, making sure they're telling their parents. And also, this is a great age to start with allowing them to give the doctor a report on how they're doing in general. So discussions for teaching, it'd be inhaler self-management. And this is the age too with how do you feel about having asthma and helping them assess if their asthma is in control. Help them get to know an asthma control test. You could ask a student, do you know when you need your epinephrine? And how would you go about getting your epinephrine if you needed it? At high school, we want to kind of seal the deal here. This is age 15 to 17. Students need assistance in making choices and avoiding exposures and managing symptoms. And in a perfect world, we would help these kids work towards being independent in their care. So when we're looking at these overall skills, we want the child to be able to perform self-care. We want them to understand the physiology of their condition and make appropriate decisions and positive decisions. They should be able to identify their inhalers and the action of their inhaler, and they should take the lead in managing symptoms and taking their medications. With allergies, they need to take responsibility to avoid allergens. They need to carry epinephrine responsibly, and they need to know when and how to administer emergency medication. I had a very good friend who was a high school nurse. And if a student needed their epinephrine in high school, she would sit knee to knee with them in 2 chairs. She'd have the student, in front of her, and she would have the student give themselves the epinephrine, but she would put her hand over theirs. And often that really helped because it gets that little kickback, and that way the student wouldn't let go of it and have the epinephrine dripping down their leg or whatever, but they had the feeling of how to do it themselves. So valuable. And special considerations for high school students are looking at independence. We really want them doing their own care. And this is really hard for some parents. So you have to always make sure you're remembering that they're a team. You want them to be able to self-advocate for themselves in their care. And you want to be ready to launch them. If they're going to go to college or move out of the house within a year after high school, they need to know how to manage their condition in an independent setting, meaning how often should you get to the doctor? How are you going to get your medications? What do you do with prescriptions? So there's a lot to learn. So again, discussion could be, when's your next doctor's appointment? What are you going to be prepared to discuss? Look at medication self-management, have them consider picking up their own prescriptions, identify when asthma is controlled and when they're having a medical emergency. For allergies, epinephrine self-management, including teaching them to watch the expiration date on their auto-injector, allergen avoidance, food label reading, and managing in a restaurant setting. That's huge for both food and latex allergy patients. So I wanted, before we get to questions, provide you with some evidence-based resources for teaching and for care. So Allergy and Asthma Network, we have a lot for you. One thing that we have is our 101 guides, understanding asthma, allergies, anaphylaxis, and we have atopic dermatitis as well. These are like an asthma 101 or an anaphylaxis 101. It's written at a 6th grade reading level, and this would be a great thing to have on hand for people that are newly diagnosed. Posters. We have the respiratory treatments poster. There'll be a follow-up email after this webinar with the link in it to take you to where we have our posters. But we have respiratory treatments, and we have them in English and Spanish. And it's revised like every 6 months. So if you have one, it might be old, so take a look. And we have Anaphylaxis at a Glance, which is a really great poster to help people understand what is anaphylaxis and what should you do. And then we have epinephrine treatments, and that's very much like respiratory treatments, only it's showing you all the different options for epinephrine. And if the nasal becomes available, that'll be on here too. This is the Allergy and Anaphylaxis Practical Guide I talked to you about. It's got 3 sections. One is Allergy 101, another is School Safety Guidance for Allergy Management, and this is where you have those tabletop drills. And then we have educational resources for student and staff instruction. We will be updating this year, and you can watch for that. Another great resource is Take Action, Take Control. Allergy and Asthma Network worked with the Chest Foundation, and we developed a great poster with symptoms, steps to control asthma, and signs that your asthma may be difficult to control. So this would be a great poster for the health office for all your students with asthma. And it's available at asthmachestnetorg, and I put that there. So web-based resources for teaching. These are my favorites. One is the Kids Health website by Nemours. These have portals for educators and teachers guides, but what I love about this website, and it's kidshealth.org, is that they've got like 3 different portals you can come into. One is for kids, one's for teens, one's for adults. So if you're looking for something in kid language to use as a teaching tool, that's a great place to go. Another curriculum that I used to teach at school, I partnered with the physical education teacher. We did this after school and the kids took the late bus home, is Open Airways. This is put out by the American Lung Association, and it is fabulous. I did a little study where I looked at attendance for the 3 semesters before they took it and the 3 semesters after, and it was stunning how kids were in school more with their asthma when they really understood it. And then we have 2 resources from the St. Louis Children's Hospital. And one is Food Allergy Management and Education, or FAME, and one is AIMS, Asthma Management and Education for Schools. If you just Google FAME Allergy or AIMS Asthma, these will come up. So just to finish up, children and teens should feel really good about their asthma and allergy care. They should be fully participating in activities, even activities that are physical if you have asthma or where there may be some allergens present. Learn how to fully participate. We want kids to sleep well. I think we'd solve 90% of the world's problems if everybody was sleeping well. Have a good sleep routine. Make sure kids are not having asthma symptoms at night. Anxiety about chronic health conditions really come out at bedtime. And make sure that you're checking on a student for that. And then convince them to consider having just a normal life. A lot of people don't feel very normal when they have asthma or allergies, but make sure they're having normal or near normal lung function and that they don't feel isolated with their food allergy at school. We'd like to see them having few or no ER visits. And this is another thing where I think when we have school nurses available to students, that goes way down. We want to think about preventative care. We want to see very few side effects, the right medication at the right time, quick relief versus controller for asthma medications. And then we always say epinephrine first, epinephrine fast in an anaphylactic emergency. We also want to encourage growing independence. And again, sometimes this is harder for the parent than it is for the child. We want them to just feel good about who they are and feel empowered to live a full life. So educated students equal empowered students equals positive health outcomes. Children need to learn how to take care of their chronic conditions. When they do, they can self-manage and react quickly in emergencies, and more children can have positive outcomes like Riley. So at this time, I'm going to look to see if there are some questions in our question box, and then we'll get to as many of those as we can. So Angela asks, can we receive a copy of the PowerPoint slides? It won't be sent to your email, Angela, but you can go to our website. On our website where the registration is at the bottom of our homepage, look for this webinar, and there will be a PDF file of the slides that you can get. And could you please tell us more about the upcoming nasal epinephrine? I don't have information to share with you about that yet. I just wanted to let you know it was on the horizon. And if it becomes something that is available to you, you better believe we'll help you with figuring all of that out as it goes. And the next question is, how much of asthma is attributed to air pollution? A lot of air quality has a huge impact on asthma. We really see students, on those. Actually, there's a great tool on our website. If you look up at the top, it's a weather portal, and you can check if it's a high difficulty with asthma day. But really, there's a lot of air quality websites that are very reputable. But the students that have asthma, they're going to have more difficulties on days that there's air quality issues. Somebody said, how are students misusing their inhalers? Great points regarding short videos to educate. So students have a lot of trouble with that kind of actuation, where it's the pump down, breathe in, and all that. Spacers obviously help a lot. The videos that we just love are the ones from National Jewish Hospital. If you, again, go ahead. Can you tell I like to Google National Jewish Hospital videos? They are on our website, but that's just a really easy way to find them. And they will show you how to use different inhalers. And I mean every kind of inhaler, whether they're MDIs or DPIs or whatever. So that's really important. So, please remember that doctors are not the only providers that care for asthma. Thank you. Nurse practitioners and physician's assistants provide a great deal of education, assessment, prescriptions, etc. Susan, thank you for that. Every once in a while, as I get to talking, I get to talking about doctors more, but you're absolutely right. Nurse practitioners and PAs are totally important partners in asthma care. Okay. Can you repeat the address, web address for the asthma chest handout? It's, let's go back. I think I'd get really close without looking, but let's go ahead and look just to be sure that I'm getting it absolutely right. Here we go, asthma.chestnet.org. So there you go, asthma.chestnet.org. And somebody said, this is an awesome presentation. Thank you. Well, I thank you for being here today. So where can I get help with asthma meds? I'm assuming that, and of course it's hard when I see that because I don't know exactly what you're referring to of how you would get, what kind of help you're looking for, whether it's how to administer them or whatever, but I'm going to assume that you're asking about affording asthma meds. And if you go to our website under asthma, you'll see link to on all the headings underneath the word asthma, you'll see one that says prescription medication assistance. If you click on there, there'll be a whole long list of the asthma medications that are available and where to call, or a link for a website of how to get some medication assistance for that. So I hope that's helpful. Do you have social stories already created to use with students with special needs? No, I don't, Laura. That would be like totally awesome. If you want to email me, we could talk about that. So someone asks, is it important to understand the difference between bronchospasm versus inflammation when characterizing symptoms? Well, you're going to see slightly different symptoms whether you're having bronchospasm or simply inflammation. Inflammation is not where you get that coughing and wheezing as much. That's much more with bronchospasm. So that would lead you to understand a little bit more about which symptoms are present. So how do you get support for getting providers to sign up for stocking albuterol and supplying it? Great question, Marilyn. There are a lot of states already have a law. There you could work with the legislator to see what's provided in the bill. If you don't have a bill, work with your state school nursing association. Most of them are very supportive of stock albuterol. Not every single one of them, but that can help too. Also, if you really need some help, you can email me and I'll send you to somebody on our staff that's working very closely with stock albuterol in the States. So someone asked, is this presentation in Spanish? I would love it if it was in Spanish, Raul, but I don't speak Spanish, so that would make it kind of hard. But that's one thing I have to admit that I never did, that I always thought I should go ahead and do. So how do I print out today's certificate? If you're listening live, you're going to look on the control panel for your GoToWebinar control panel. It'll say handouts, and you'll find the certificate there. You can download it and print it, and I'd suggest you do that now. If you can't figure that out or you don't see a handouts pane, go ahead and email us and we'll get that to you. So how can we watch this webinar again? Dora, it will be on our website. If you scroll all the way down our homepage, there'll be the webinars will be listed, and you can click right on the one with this title and you'll be able to listen again. And you can share it as well. And I hope that that some of these things will be great to share. So here's someone that says, as a mom with 2 children with food allergies, it was a fine line with my daughter to teach and take seriously how to perform in an emergency. She became very anxious and scared. Any suggestions? Oh, Kathleen, that is such an important issue. This is scary to kids because, how do you get them to buy into the level of emergency it is, without going, and you might die. And so, but of course, is usually the elephant in the middle of the room as you're discussing these things. I think talking about how focus on the positive of how the medication is going to help you rather than what's going to happen if you don't get it. Teach them, tell that they should tell people they need the medication first and they need it fast. And another thing that's really important is to help people understand that Benadryl is not the first line medication in anaphylaxis. If a child is in anaphylaxis, they need to get epinephrine. The Benadryl, it takes 30 minutes to work. And all antihistamines, it'll take about 30 minutes to work, and you don't really always have 30 minutes. Epinephrine works very quickly. It gets right into the bloodstream. So maybe help them, think about, that the goal is to get someone to help you fast, but kind of think more about how much the medication is going to help them rather than scaring them. And it's really easy to scare a lot of children. Children with food allergies do tend to be very anxious. And we were actually work with a psychologist who has a program for food allergy children, and she is wonderful with them. But this is an anxiety-producing thing for parents and for kids. I had one student when I was in the middle school one time who I was talking to her and I said, now, if you ever have an allergic reaction, I'll bring the epinephrine right with me and we can just give it to you right at your desk. And she said, no. And I was like, okay, I don't understand what the problem is here. And she thought whenever her mom had given it to her, she had made her take her pants off and then she gave it to her. I said, no, I'm not going to make you take your pants off in the classroom. We're going to be able to put this right through your pants and I'm going to be able to help you and you won't be embarrassed at all about what's going to happen. And if you want to go out in the hall, we can do that too. But I'm not going to make you take your pants off in the classroom. So there's a lot of issues that come up. So can you give us the name of the website to download the information? Our website is allergyasthmanetwork.org, and it'll be on the last slide as well in just a moment. So, okay, community health workers have been a crucial public health partner in teaching asthma management. Thank you for that, Linda. Community health workers have a very important role in asthma management. In fact, if you watch for our webinars, we're going to have a webinar on February 2nd on asthma home visits, and there'll be some talk about community health workers in that one. So thank you for posing that. Okay. Okay, let me look to see here. I'm getting a lot of thank yous. That kind of makes my day. Thank you very much. Okay, one more time. Someone's asking where to find the PDF of the presentation. It's going to be on our website at allergyasthmanetwork.org. Scroll down the homepage. It'll be at the bottom. Find this webinar, and when you click on there, there'll be the recording for the presentation as well as a PDF of the slides. So, here's an interesting question. A parent brought in Primatene Mist with a provider order for their child. What kind of risks might this present? Allergy Asthma Network for a long time has not encouraged the use of Primatene Mist. In fact, at times in our history, we have been incredibly vocal about how we think that it's a mistake. So of course, I've now just named a product with a product name, which I don't like to do, but this isn't for continuing education, so I can do that. But I don't not necessarily promote products or not products, but I will say that the risk that Primatene Mist holds in my mind the most is that often people who use it don't get care. They don't get any care beyond using this over-the-counter medication. And asthma is serious and it needs to be managed by a board-certified allergist or pulmonologist. And that's why I think that is the biggest part of its problem. So, okay, well, thank you very much, everybody, for listening today. We're going to just finish out here with, I would like to encourage you to join us for our next webinar. And that'll be COVID-19 and immunity issues, upcoming treatment options. And this will be on January 20th at 4:00 p.m. You can register for it on our website. So here's the web address, like we discussed a few minutes ago. And I'd like to just thank you again for joining us. This is Sally Schoessler, the staff at Allergy and Asthma Network. We are here to help you with your needs in caring for allergies and asthma, whether you are a patient, caregiver, or healthcare professional. We are also here so that we can all breathe better together. Have a great day.